Welcome to my channel, Brainies. In today's video, I'm going to deliver a presentation on the topic Syringomyelia. What is Syringomyelia? It is a rare neurological disorder which has been characterized by the presence of the fluid-filled cavity, which is known as syrinx. It is present within the spinal cord. This syrinx can expand over time, thereby damaging the surrounding spinal cord tissue, and it leads to a variety of clinical features. This syringomyelia, it refers to the presence of syrinx, that is a cavity or cyst within the spinal cord. This cavity is filled with CSF, that is the cerebrospinal fluid, and can disrupt the normal spinal cord function. It is often associated with other abnormalities such as ulnar Chiari malformations, spinal cord tumors, or trauma. What is the etiology of syringomyelia? It is often caused by the underlying conditions that disrupts the normal flow of the CSF around the spinal cord. One such cause is Chiari malformation, where the cerebellum protrudes into the spinal canal. Actually speaking, the exact cause of syringomyelia is not always very clear, but however it has been broadly classified into two main types based on the etiology. The first one is the primary syringomyelia, which is also called as communicating syringomyelia. It is often associated with Chiari malformations, where the cerebellar tonsils extends into the cervical spinal canal, thereby disrupting the normal flow of CSF. The next type is the secondary syringomyelia, which is also called as non-communicating syringomyelia. It typically arises due to the spinal cord injury, tumors, meningitis, and arachnoiditis. These conditions once again leads to the obstruction of the normal CSF flow, resulting in the syrinx formation. The pathology of it. So as stated previously, this syringomyelia is characterized by syrinx within the spinal cord. This syrinx can expand over time, damaging the surrounding spinal cord tissue and leading to various neurological symptoms: syrinx formation, tissue damage, sensory and motor impairments, and it can progress over time, thereby leading to worsening of symptoms. The clinical presentation of syringomyelia can vary based on the location and size of the syrinx. The common symptoms includes pain, which is often present in the neck, shoulders, and back; weakness and atrophy, particularly in the hands and arms; sensory disturbances like loss of temperature and pain sensation in a cape-like distribution over the shoulders and arms; reflex changes, it could be hyperreflexia or hyporeflexia in the affected limbs; scoliosis and autonomic dysfunction such as sweat abnormalities and bladder or bowel dysfunction. The management of syringomyelia, it depends upon the underlying cause, the size of the syrinx, the location of the syrinx, and the severity of the symptoms. So thereby the treatment options include observation, that is in asymptomatic or mild symptomatic cases, regular monitoring with MRI scans, so to track the progression of the syrinx; surgical intervention. The primary treatment for symptomatic syringomyelia, especially when it is associated with Chiari malformations or other treatable conditions, the surgical options include posterior fossa decompression. For Chiari malformation related syringomyelia, which involves removing bone at the back of the skull and spine to create more space for the cerebellum and to restore the normal CSF flow. The next option is the syrinx shunting, inserting a tube to drain the syrinx and reduce the pressure. Next is treating the underlying cause, such as removing a spinal cord tumor or addressing the spinal trauma. Symptomatic treatment, it includes managing pain with medications, physical therapy to maintain the muscle strength and functions, and occupational therapy to assist with daily activities. That's it with today's video. Thank you for watching. Kindly support by subscribing and sharing. Meet you all in next video. Thank you once again.